Let me ask you guys this. Do you guys know of anyone that turns hot and cold in an instant? For example, a loving and caring person all of a sudden become mean and angry. I have a close friend that exhibits these signs and symptoms, and she is diagnosed with borderline personality disorder. It is imperative to know what borderline personality disorder is, because you might have a loved one that you care deeply for that exhibits these signs and symptoms, and it is good to provide moral support and advise them to seek professional help if they need. So to effectively understand what borderline personality disorder is, one needs to know what it really is, the signs and symptoms, and the treatments for it. First of all, I would like to talk to you guys, what is borderline personality disorder? So according to the American Psychiatric Associations in 2004, borderline personality disorder is a pervasive instability of moods, interpersonal relationships, self-image, and behavior. So what is the origin of borderline personality disorder? So there's no specific cause for it, but some of the risk factors are neglect and child abuse, genetics, and culture. So as the friend that I have mentioned earlier, she suffered from abuse as a child by her father. Now let's go ahead and take a look at the signs and symptoms of borderline personality disorder. So again, according to the American Psychiatric Association's 2004, in order to be diagnosed with borderline personality disorder, one needs to exhibit at least 5 out of the 9 symptoms. So the first one is sensation seeker. It's those that exhibits impulsive behaviors such as uncontrolled shopping spree, reckless driving, and substance abuse. Second, self-harm. Third, extreme mood swings. Fourth, explosiveness. Fifth, fear of abandonment. Sixth, unstable sense of identity. 7, feeling emptiness. 8, up and down relationships with significant other. And last, dissociation, which is feeling out of touch with reality. So not everyone will have the same combinations of these symptoms. So just like ordering from a Chinese menu, you can order a different variety of different items that you can be put in your plate. So now you have idea of what are the signs and symptoms. Let's take a look of the treatments. So according to the National Institute of Mental Health website, BPD has historically been viewed as difficult to treat. However, with newer and proper treatment, many people with BPD experience fewer or less severe symptoms and improved quality of life. So the first treatment is psychotherapy. Psychotherapy is the most common treatment. It's also known as talk sessions, where the patient can have a one-on-one session or talk in a group settings with other people and with the specialist. Second is when one exhibits impulsive behaviors, they can write down their thoughts and feelings in a journal and reflect on it and see what are the possible causes that make them think or act the way that they did. Third is from a book written by Paul D. Mason and Randy Krager on Stop Walking on Eggshells. They recommend for the sensation seekers to take healthier approaches such as backpacking, hiking, or kayaking when they feel the need to have those impulsive behaviors. Last is the least approach is medications such as antidepressants and antipsychotics. These should be closely monitored because of the high side effects that a patient can have. So the doctor would order lab works and have a thorough physical assessment for it. Okay, so now you have to take a look at what borderline personality really is, the signs and symptoms, and the treatments. Maybe there is someone that you do deeply care about might exhibit these signs and symptoms, and you can provide you can provide moral support and advise them to seek professional help from a specialist. Thank you so much for listening today.